I'm Thurston County Commissioner Ty Menser, and today we're here and you get a chance to meet our new Director of Public Health and Social Services, David Bayne, and our new Assistant Director of Public Health and Social Services, Dr. Jen Freiheit. Thank you for being here today, guys.
Thanks for having us.
So you're both new to your positions here at Thurston County. Tell us more about your previous experience in public health and what inspired you to pursue public health at the local level here in our county. Start with you, David.
Yeah, I'll jump in. Okay, so I kind of had a long, windy road to public health, which is I think how most people have their road to public health. It's windy and unexpected. I have always been a policy geek and really loved health policy in particular, but I was kind of a budget guy and kind of thought about the world through the lens of finances and budget. I got pulled into public health budgets in Georgia. And kind of fell in love with the scope of public health and how broad it was. And then I think within my second year of public health in Georgia, we had, I think, Zika, and then Ebola came after that, and then we had some other outbreaks, and I just got really excited about this area where there was never a dull moment, and I was influencing, right, a whole population versus just individual people. I think even growing up, I grew up in a pretty low-income family, and so the social determinants of health for me isn't just like a buzzword. I actually lived it and experienced it, and being able to marry my policy love with my actual lived experience is always just exciting for me. I got the opportunity to work in Washington State for public health at the State Department. Loved it, but I was living at like a 10,000-foot level, and being able to work at the community. I live here in Thurston. My kid goes to school here. Felt like a unique opportunity to be able to do public health locally where I could see my impact, like actually see and touch and feel it. So that's the journey that I came on here for public health.
What was the position you had with the state?
So I had two roles there, both in leadership. One was as their public affairs director, so I had that role. I had that role going into COVID, so I got to be part of all the communications effort and community engagement. So that was a literally life-changing experience. And then created a new office at DOH, which is still there, which is the partnership office, which is where I engage with our local health partners, with our tribes, and then with our kind of private sector partners. So it was a really nice fit to go from that to actually working with the people that I've been partnered with for years.
Awesome. How about you, Jen?
Yeah, I have always been on the public health track. I started out in my undergraduate with an environmental health bent, planetary health. Couldn't pass chemistry. So then I went on to teach health education at the high school level, but I wanted to make a bigger impact. So that's where my path to public health came into population health, whole community health, and that policy piece as well, being able to serve more than the one-on-one medical model, being able to make a bigger impact into communities. So when I went back to school, it was really with that population health focus, and then have served 21 years in public health, both state and local, largely at the local level. And I came to Thurston County because it's sort of a full circle moment. My family's from the area. My dad was born in Aberdeen and my grandparents died in Bremerton. So this whole area has a full circle meaning to come back here and to be able to serve in this region where my family is from. So I really appreciate the fact that in local public health, I can go home at night and say, I made a difference today, even if it was some small decision or some small little impact. And at the leadership level, I really get joy out of serving and supporting our teams who are out in the field and supporting the community, and the fact that I can make internal tweaks or adjustments that help support them and just make them more efficient and able to serve better. That is where I get true joy. So I really do appreciate the public health leadership component here.
Great. So you both came into your positions as pandemic emergency restrictions were winding down.
Yep.
It's been a tough few years for our community, and while we don't have the same restrictions in place, we're obviously still dealing with COVID and its after effects. So I'd like to ask each of you, what challenges do you see in managing COVID restrictions here in Thurston County as we move forward?
Yeah, I mean, I think you said it well. We're moving away from those restrictions, and we're in a different phase now where we're approaching COVID as if it is more endemic versus pandemic. So this is something where I think the goal, not just in Thurston, but nationally, is for us to treat COVID as we do other infectious diseases. And so we get to a place where people are regularly vaccinated, where when there's times of kind of high rates, we either mask up or just sort of pay attention to those kind of trends. we're not in a space anymore where we have to sort of focus in on sort of policy restrictions. So, I mean, that is just a bygone phase for us at this point. It doesn't mean COVID's gone. It just means that our need for those kind of policy levers is no longer there. So, again, we're shifting to a place where how do we continue to sort of manage COVID as if it is another kind of highly infectious disease? That's kind of the goal there. In terms of the challenges, I mean, there's a challenge to me of how do we get out of sort of seeing COVID as just this unique thing where we had a lot of temporary resources and funding put in place to deal with an issue that came up. How do we have sustainable resources, sustainable staffing to deal with other, right, not just COVID, but other potential diseases that come? And so I think one of the lessons learned, frankly, for COVID, not just in Thurston, but nationally, was public health needs to be better prepared sort of in general. And the trend for decades has been something really bad happens. We put a lot of resources into it. The bad thing goes away. We take the resources out, repeat cycle over and over again. And I think what I've been excited about, particularly in Washington State and with Thurston County, has been a commitment to supporting public health regardless of kind of what phase we're in, and starting to build up our foundation so that we're ready for the next thing that happens. Because there will be a next thing, right? We don't know what it'll be, what it'll look like, but we know there will be a next thing. And so for me, we're in a stage now where we're trying to do lessons learned from COVID. That's kind of where my brain is at this point. And also thinking about not just the lessons learned from a community perspective, but as a team. This was a traumatic experience. You said this, right? I mean, we put people through the ringer. And I'm so proud of the staff, both here at the state level, who worked crazy hours and days to kind of make sure that we were safe. We still have a lot of work to do with the resiliency there, right? Making sure staff feel supported and are ready for the next thing to come. Things that I am excited about is we met a lot of new partners through this process. I think one of the things that I'm really excited about in my role is being able to play off those partnerships, right? So we have connections with, say, the schools in a way that was just not as close before the pandemic. And now we have these regular conversations, and I want to see us build off of those, right, for other public health ideas and instructions. Working with the corrections system and law enforcement, we've got a better relationship there than we've had in years after working with them through the pandemic. So I think this is an opportunity to leverage those partnerships, those relationships in new ways going past COVID. So that's kind of where my brain is at.
One of the things you made reference to that maybe the folks watching the program have not tracked is that the legislature made significant investments in what we're calling foundational public health services. And that's hopefully a way to weave the COVID stuff beyond, as you say, the one-time expenditures into a foundational system that will better support our response to these things. And so that's something for folks to know. Jen, anything on COVID you wanted to add?
No, he summed it up nicely.
Okay, very good. So now that you've both been working here for a few months, I imagine you both have some initial observations about public health trends in Thurston County, things that jumped out at you, different than where you came from or whatnot. I'd like to ask each of you, what initial public health trends have you observed during your initial few months here?
Yeah, I'll take a stab, and then I'll give Jen a take at this too. I had a couple of thoughts, and this is related sort of to COVID in terms of vaccine efforts, but immunizations is an area that I think we can improve on in Thurston County. So think about those sort of mandatory vaccines for kids, for example. I think the trend has been okay.
Separate from COVID.
Correct. So this is non-COVID vaccines. Think about your MMRs, your measles, mumps, rubella. We have seen not great trends since COVID started for reasons that make sense. But this is an area that I think we can really improve on our childhood immunization rates. But I also think that there's better connections we could make with our pharmacies, with our local pediatricians, and kind of boosting both education efforts and outreach efforts in that area. I'm also really interested in pursuing chronic disease prevention. This is an area that, again, in the midst of the pandemic, we focused, as we had to, on this kind of immediate threat. In the meantime, there's these other public health threats that have been lurking for years. And again, if you look at the data, like we look at things like hypertension, diabetes rates all went up over the last couple of years. And I think as a county, we need to be more thoughtful about our approach to prevention in that way. And then last but certainly not least, opioids, I think is the thing that's probably first and foremost in my mind as I think about what are the concerning trends in Thurston. It's opioids. And I know we'll talk about that a little bit later, but I'd say those are my big three that I can think of off the top of my head would be immunizations, prevention, particularly chronic disease, and then opioids. And then I think Jen's got a couple other ones that we're looking at too.
Yeah, I think that post-COVID, we really learned, we public health, not just Thurston County, but public health across the country learned that we have to look at things differently. We have to be much better data gatherers. Epidemiology is always the base science of public health, and we've always operated using science and epidemiology, but looking at how we both gather data and then display that data and utilize that data to inform our services and our programs. And so also looking at, again, public health has always been educators out in the community educating, but how we do that much, much differently is what I think an outcome of COVID was, both prevention and education. And there was research that came out right before COVID that was really showing that 50% of a person's health outcomes are based in what are called the social determinants of health. So a person's socioeconomic status, their job status, education, transportation, their built environment, the neighborhood, are there enough streetlights and sidewalks and parks to play in, the social support system, both family support and social support. All of these play into 50% of a person's health outcomes, their life expectancy, their morbidity, mortality. So I think it's really, COVID shone a light on public health. This is a new phase of public health. We have to definitely work in these realms with corrections, with schools, with all of these entities in a much, much new way in order to impact their health. And it can't just be going to health fairs or doing little education summits here and there. It's a much different way of how we become mobile, get out into the neighborhoods, work with the communities that really need the information, need the intervention, and really us acting as sort of a resource hub with the data and with all of the expertise we have in-house in order to better present those health behaviors, outcomes, access to healthcare out in the community. So I think that some of that really positions us to be this chief health strategist with all of our partners in the community. So that you've heard the term collective impact, and that's what we're living and breathing every day, is how do we not be on the pillar of the expertise, but how do we bring all the expertise together and do those community health assessments and community health improvement plans and really strategize for better health for everyone to be involved and not just operate in silos. So that has definitely been a trend that is pre-pandemic, but definitely more focused on post-pandemic as we sort of look to, and it's perfect timing right now for both of us together with being new to say, okay, how do we ride this wave and be on the cusp of public health moving forward to make a greater impact on the community?
I want to circle back to two of the things you guys just mentioned. One of them about the opioid crisis, because that's something that we've spent time on as Board of County Commissioners and at every level. We've had some trends of increasing opioid overdose deaths, specifically related to fentanyl. Situation happened in the jail. We've had just different, the coroner has come to the Board of County Commissioners with some alarming statistics. How is the Public Health Department approaching this crisis and overdose trend, and what actions can the community take to try to have an impact?
Yeah, I mean, I think you said it well in that there's just no escaping that where the trend has been heading. It's been, I think, a tough couple of years especially. We've seen not a good trend for maybe a decade, but really the last 3 or 4 years, you've seen kind of a dramatic increase, and most of the data shows that fentanyl is really driving a lot of that increase. I think the Public Health Department, I think the first thing I would say about it is that we can't do it by ourselves. And I think that sometimes public health has kind of been kind of the Lone Ranger, kind of going after the pandemic. I think we cannot approach this without being collaborative, whether it's with law enforcement, whether it's with school systems, whether it's providers. I think, so my first response to you is really we need an all-hands-on-deck approach to this. I think the role that we have, and Jen mentioned this, there's a data component. You don't know the extent of this without data, right? So I think there's a really big role we play in that. I think that the education outreach piece, which I think may seem small, I think is really huge. The longer I've been around in this area, the more I realize that like my level of information about fentanyl and opioid overdoses is actually much higher than the average person's. And I sometimes can make assumptions. Everybody knows this is what's going on. Everybody knows how bad this is. It's not true. So I think part of it is making sure that we do a good job with our outreach and awareness, not just not just in scaring people. I mean, there's an element where you have to understand the seriousness of this, but also in what are the action steps you can take. And the biggest thing that we're looking at right now is with Narcan, right, which is how we can prevent overdose deaths. And so we've done, I think, a really good job in Thurston of making sure that we are spreading the good news of access to Narcan. You can get it at your local pharmacy. We have provided law enforcement with Narcan. This is an area where I think that we've got a lot of energy and attention, but we can still do more on that front. That's a really big piece of it. I think some of it is clearing up myths and rumors about the opioid crisis. So even though we know fentanyl is deadly serious, there has been some information that's been misinformation. Like I think there was a scare that law enforcement, if they just touched fentanyl, they might overdose and die. I think that was a kind of an urban myth that isn't true. And my worry was that with that misinformation, you'll have, say, law enforcement less likely to want to engage, right, if someone's in trouble. And so trying to clear up what is true and what is not is a really big part of our jobs. The thing that I'm probably most proud of coming into the county is that you already had a Thurston County Opioid Task Force, which of course the board authorized about 5 years ago.
2018.
And so I think a lot of the work we're doing is really structured from that group. They've got like a 4 or 5 point plan of kind of key topics that they're working on. I'll list a couple of those. One is preventing the initial misuse of opioids, so that's an education piece early on. There's expanding access to treatment, which is a huge piece for Washington State. We struggle with having enough providers who can provide treatment for those who are in addiction. Preventing overdoses, so again, Narcan being a key component of that. And then we're looking at specific groups, reducing exposure to children, youth, and families. One area that I'm really proud of us kind of turning our attention to is looking at pregnant women, for example, and working on reducing misuse in that population. Beyond that, I'd say we've got kind of a wide variety of education opportunities for folks about overdose, guidance. I think the thing that I'm looking forward to the most is the fact that we now have the opioid settlement funds. I think we are still looking at the final numbers, so I'm not going to try to quote the exact number, but it'll be a significant investment from those lawsuits against distributors, correct.
And there's more lawsuits involving manufacturers.
Correct. So it's not done yet. The MOU agreement between the states, the municipalities, the counties with these distributors lays out some key areas that you're supposed to target with the funding. And not coincidentally, it matches what I just mentioned for the topic areas for the task force. So for us in Thurston, we don't have to start from scratch. Like we know these key areas. We actually know the partners and providers. So it really is kind of finally putting money behind the things we've been working towards for 5 years. So I know it's a long answer, but that's kind of the thing that I've been spending a lot of energy on.
And Jen, in your answer, you touched on social determinants of health, and you didn't use the word, but it sounded like a lot of the things you were talking about would relate to equity and equity of access to all the different parameters that affect someone's health.
Right.
I'm curious, and either one of you can answer, but I'm curious what the department has attention been placed specifically on equity issues, and how is that connected to the health trends you've seen and your overall vision for the department going forward?
Well, and I just wanted to add on the opioids. I mean, obviously it's not its own isolated topic, right? And that's where the Public Health and Social Services Department is so equipped to handle the influx of money and the work that's necessary, because we have our housing division. We are heavily focused on behavioral health and how behavioral health is public health and how we can integrate that. Mental well-being is considered by the World Health Organization as a global health crisis, and we see this across the country in every community health assessment, how behavioral health and mental well-being is a primary focus for health departments. And so that plays into all of our various components, from our Veterans Assistance Program to our developmental disabilities to the Special Recreation Program and our Nurse-Family Partnership. That's the overriding, and opioids also is integrated in all those programs. So we cannot tease out our programs, as far as, what is trending. They all integrate together. But I think what public health, equity is a new buzzword that everybody's using now, but public health has always operated in that realm. You also hear upstream, that there's people in the medical model that work downstream, and then there's people that work upstream. That's the public health partners and all the partners that collaborate together. So we are always looking at who are our marginalized populations, our most vulnerable communities, and how do we reach them better with data, education, outreach, and are always looking to how do we incorporate our programs and services to the communities that need it most, as opposed to an equality model. But I'll let you go further into the equity component.
That's a great setup, and I'm glad that you asked that, Commissioner. I think in terms of the department's direct work, I mean, again, as folks who are new, we're still trying to assess kind of where we are versus coming in with giant grand plans. I think we are ready, I think, as a department to integrate the equity concepts that Joe was talking about into like our day-to-day. So I think from a community perspective, we've been doing the work. I think I want to see a change within the department, whether it comes down to our hiring processes, it comes down to our own internal policies and procedures. Like equity starts literally within the department. I think that's an area that I think we could grow in significantly. We're due for a strategic plan update as a department, I think next year actually. And it will not be a surprise to see that being kind of one of the key kind of backbone to that plan. My hope, my goal is that each of our key areas, within departments, that they each see themselves in the equity part, right? It's not just the mothers and children. That's an easy one people to think about with equity. Equity and environmental health is a key component that people don't always talk about, right? There's a link in each of our areas to equity that I want us to make explicit and to see it in our day-to-day. That's my hope and my goal, is to see that listed out. Another thing that we'll be doing in the next 2 years will be looking at a community health assessment for the department, for the county. And I think that, again, the lens of equity driving that assessment will be so key for us. So again, we're not working off just anecdotes, but actual data that shows where those gaps are. We have done some initial work. You referenced something with, we look at disparities with African-American women and their outcomes for birth, for example, in Thurston County. You can see a noticeable gap. Things like that kind of data is so key for us to know where those equity gaps are and then how we as the department can fill those in. But for me, I'm excited about kind of coming in, taking stock of where we are, and really using this year to kind of build momentum towards, like I said, an actual plan that the community can hold us accountable to moving forward. So, yeah.
Great. So to kind of wrap up the question and answer part, both of you made reference to a whole series of programs, and you made reference to the different divisions. For folks out there who may not really understand the breadth of the public health department, Thurston County, maybe, David, could you kind of outline for people the different divisions that you've got under your purview?
This is like my 6-month pop quiz, right?
Yeah, pop quiz.
How much do I know yet?
Because I mean, it's something I remember being pretty surprised about when I became commissioner, just how much public health does, and it's not all perfectly connected to each other. There's some pretty different different things going on.
Correct, and I would say it was a plug. One of my goals is actually to connect those dots better, frankly, so that you can see the link between the different groups. But yeah, we range through a lot of things. So we've got environmental health, which is one of the most kind of probably publicly known parts of public health. If you're looking at our regulatory permits for things like waste or septic tank uses or restaurant inspection, those are all within that body of work. But we also do things with maternal and child health. So we have nurse-family partnerships, do home visits. We have work that looks at prevention for chronic disease. We have work over in housing, and so we're looking at things like rent assistance and supporting the local municipalities in their efforts against houselessness. We also do work with veterans. We've got a fund in the county that we administer to support veterans. We've got a small program for developmental disabilities. I mean, this is quite the range, right? And I haven't even touched on our disease control prevention work. So this is all of our surveillance and outbreak control work right there. Immunizations, we have an immunizations coordinator who works at those issues beyond COVID as well. So I mean, this is a wide-ranging department, which is one of the things I love about it. We also have connections to the behavioral health, including supporting the treatment sales tax here in Thurston County that lives here in public health. So yeah, it's hard for us not to touch something, right? And so one of the things I'm excited about is the fact that we also get to work with all the other departments. There's not a department in Thurston County that I don't have to connect with at some point in an area. So that's kind of the way we look at public health. It's pretty broad.
Thanks again for joining me today, David and Jennifer. This has been a great conversation about Thurston County Public Health. For everyone watching, if you want to keep track of your local government, join our YouTube channel. There you can watch Board of County Commissioners meetings, work sessions, and programs like this one.